Finally, in Better Health, we have a look at the Family Mental Health Service, which has been in operation for 35 years.
Well, I was working at the University of Otago. I was chairman of the education department at that time. We landed a contract for the training of educational psychologists, and I was looking for placements for students. And my wife worked at Mosgiel Health Centre as a GP, and McCarricker, my first wife, and she introduced me to the doctors here and to that scene, and I became very much part of the Mosgiel area. I lived here, that was a help too, and we started together talking about community, social applications, professionals working together, both of us a bit tired of the professionalism which was in boxes. You know, there was psychiatry and psychology and social work, but the actual camaraderie, the community interaction wasn't really occurring as it should between the professions. And I saw the opportunity, and Grace saw the opportunity. In my own department, there had been for some years an education clinic, which was very unusual. It was the only one in the country. And that involved students meeting parents and dealing with children and learning how to test and assess and give advice and so on. So it seemed a great opportunity for me from the training point of view. It seemed a great opportunity from Grace's point of view to integrate all the community members if we could. There was a great bunch of doctors at the health centre at the time. They had built this new health centre, and they had started to build teams. And so I guess what happened from there on in was the programme came to us, to the education department. I brought my students here regularly. We had the manpower that we didn't have before. There was gradual addition of other people. Roy Muir started to bring some of his students, and he and his wife, who was a counsellor, started to attend. Frida Walker, who was a psychology department at university, started to bring some of psychology students. So we had really a very powerful team, and Mosgiel was the first to have that integrated concept, using the community, bringing in people, regularly meeting. We were visited at one stage by the inspectors from the health department in Wellington, and they were looking at our work and so on. And the remark they made to me personally was, aren't you an educational psychologist, and aren't these educational psychologists you're bringing into a health department? I said, yeah, that's true. I said, don't you feel something of a square peg in a round hole? So I guess that maybe that's what it takes, you know, to be a little bit prepared to be different.